So the question we really wanted to ask in doing the study was whether the outcomes with ablative radiation therapy in people who have lower risk disease are better than the outcomes we've been seeing with ablative radiation therapy for locally advanced pancreatic cancer. So we've had some nice progress made in the last few years with ablative radiation therapy for locally advanced disease. And in looking at an earlier stage population that have both smaller tumors and less chance of metastatic disease, our hypothesis was that with ablative radiation, we will see even better results. And so we went back to our prospectively maintained database within our institution that we started when we first instituted ablative radiation therapy program. And we looked for patients who had technically resectable disease who did not undergo surgery. So we identified 25 such patients with technically resectable disease who either chose not to or more commonly were deemed to be medically high risk to have complications. And we analyzed the outcomes in those, and we were very, within that population, the majority of patients were treated with either the 75 gray and 25 fractions or 67.5 gray and 15 fractions are more common regimens that we use, but a few were treated with the shorter regimens, and some were even treated with MR-guided radiation therapy. And when we looked at the outcomes, we were very pleasantly surprised that overall survival at 2 years was 44%, essentially. It was 43.7, which compares very favorably to both our locally advanced population, but also it compares favorably to surgical series, or at least some surgical series. And this is, it's worth mentioning that in this population, at least a third of the patients did not get any chemotherapy, and many did not get what we consider to be full systemic multi-agent chemotherapy. When we looked at local control, it was 20% at 2 years rate of local progression, which also is it's similar to what we see with locally advanced disease and ablative radiation therapy, but also not dissimilar from surgery. Of course, unfortunately, distant metastasis-free survival at 2 years was 20%, and sort of that tracks with the fact that many did not receive full systemic chemotherapy. But to us, these results overall are encouraging in that this is a worthwhile treatment paradigm to investigate in patients who have technically resectable disease. Some patients are just very high risk of surgery. There's a group of patients who may be at some intermediate risk, and so this may be a good option for them, and we hope to investigate this prospectively in the future.